So one common question we get is, what is an astigmatism? The patient will say, I've been told I have an astigmatism. Well, it's actually not an astigmatism. The word is astigmatism. And it is actually just the shape of the eye. So if you think of a perfect sphere like a basketball, that would be an eye that has zero astigmatism. The reality is that human eyes aren't perfectly round. The cornea is not perfectly round. It's always going to have a slightly different curvature in one meridian or direction than the other. So rather than a basketball shape, it's more like a football. So if we slice a basketball in half, we have this hemisphere, which is perfectly round no matter where we put it. If we take a football and slice it and turn around, you'll see this curvature this way, but when we turn this way, you're going to have more of a curvature. So when you have a difference in curvature, 90 degrees apart, that is referred to as astigmatism. If you want to call it an astigmatism, you can, but it's really just called astigmatism. And that can be corrected with glasses, that can be corrected with contact lenses, and that can be corrected with refractive surgery such as LASIK, and that can be corrected with cataract surgery with Toric or astigmatism correcting implant, or in smaller degrees of astigmatism, we can make small incisions called limbal or relaxing incisions, and that's performed at the same time as cataract surgery. So if you opt to have that corrected with either refractive surgery or refractive cataract surgery, the astigmatism can be corrected at the same time. So how do you know if you have astigmatism? Well, you probably don't unless somebody told you. There are actually a lot of people driving on the road that have never been to an eye doctor, and they go to the driver's license and they pass and they have astigmatism. If we bring them to the eye doctor and we measure them and we put lenses in front and do a refraction, they'll go, oh, that's actually sharper. Well, we just corrected their astigmatism. So as far as what the person experiences, all it means is that what they can see is just blurry. So if they're a little bit nearsighted, but they can see down the road, if they have astigmatism, it's just going to be that much more blurrier. In some cases, the astigmatism can actually offset the nearsightedness, so they actually can see better in the distance than someone who has just nearsightedness. So you don't necessarily know if you have it, if you have blurry vision in the distance, but can otherwise get by. You might have a little bit. It doesn't necessarily need to be corrected if it's not causing you a problem. But if it does start to interfere with your ability to do things such as not being able to pass the driver's test, then yes, that's something that might need to be corrected. Again, either with glasses, contacts, or some type of a corrective surgical procedure.